Welcome to my latest election campaign podcast, and today I want to talk about mental health. This is something really dear to me. I was the Minister for Children and the Shadow Minister for Mental Health, and I was particularly concerned about the pressures on our children and young people, and the fact that now more than 1 in 10 school-aged children have a notifiable mental illness problem, 1 in 4 of the population as a whole. It's a big problem, and yet mental health, first of all, doesn't receive the attention it should, and doesn't receive the amount of funding it should within the National Health Service. So I'm really pleased that Theresa May has given such a high profile to the issue of mental health and pledged the Conservative government after the election to make sure that mental health gets a much higher priority within the NHS. A number of initiatives are going to come in. We're going to have mental health first aiders working within companies. Stress levels on employers lead to a large loss of productivity and people taking sick leave. Stress levels on our young people in schools because of social media, the pressures of exams and everything, can have lifelong implications on young citizens. So it's really important that we take mental illness very seriously. We make sure we've got the professionals within the National Health Service able to spot signs of mental illness early and able to step in to deal with it with all sorts of talking therapies, cognitive behavioural therapies before you get to the more serious drug and other treatments available. But actually it starts really early, and one of the things I spent a lot of time in is chairing a mental health charity around perinatal mental health, where we run operations up and down the country making sure that new parents in particular bond attached strongly with their newborn babies and toddlers. Because if you get it right at that early stage, if you form a close, loving relationship with young children, it's going to affect them as they go on to school, as they grow up and go into adulthood. It's a pretty alarming statistic that if you are a teenager of 15 or 16-year-olds suffering from depression, all too common in our society today, there's something like a 95% chance that your mum was suffering some form of perinatal mental health problems or depression around the time of pregnancy. So let's make sure we get in early. Let's make sure we completely get rid of the stigma around mental illness. It is, after all, just another form of illness. And let's make sure that our young people in particular get the help and support to make sure they can grow up healthily, physically, but also mentally. And that's why it's so important, and I'm so encouraged the Prime Minister is putting this at the forefront of our health campaign in this election.